We relocated the office a few months ago. We updated all our equipment, so we have state-of-the-art.
Hi, Bernie. Come on in. We're all set for you.
Well, it's fantastic being on the ground floor now, so yeah, I think it's wonderful.
Yeah, and you know, good for people who don't do stairs, and they can walk right in, and good parking for them all, and we're going to be on the main transit line with the new Sheppard light rail, and all these things are good.
So Dr. Shapiro, we're going to take an initial impression before we start, so that I can make you a tempering when we're done. So Tanya, you can start mixing. I'm going to have a peek at my creation that I built last day. And then the impression, as you know, takes about 5 minutes to set, and then once it's set, the magic will begin. Since I was 6 and I decided I didn't want to be a bus driver anymore, I've always wanted to be a dentist. And the reason I wanted to be a dentist was growing up in the house we had, you'd always come home and you'd tell me about your patients, and I found it so interesting, and the relationship you built with them, and I like the techniques, the hands-on experience, but I also like dealing with people, and it's not the same thing every day, it's always different, so I've always really enjoyed that. Good, close up. Excellent, we don't want to drown you, lots of water.
I have a passion for dentistry. I enjoy dentistry. I love to go to work every day. It's something that I've always enjoyed, and the patients know that. They know that you're genuine, and they can see that. And that's part of the relationship we've had with them over the years.
Well, that's our philosophy. I wouldn't do anything in somebody else's mouth that I wouldn't do on my own. If I don't agree with it, I won't do it.
Well, you look after my teeth, and they're fine.
That's right. They're still in there. So I'm going to have you open, Steve. We're going to syringe in the material. This is the extremely accurate material. It just makes the lab have a very easy time making your crown. And easy is good. This afternoon, I have Dr. Steve Shapiro coming in, and I saw him last week, and he came in with a tooth that was severely broken down. It had had root canal therapy, and I rebuilt the tooth, but it needs to be fully protected. Basically, after root canal, we like to give full coronal protection, a crown, a cap. I'm going to be preparing the tooth for a state-of-the-art Procera crown, same type that Jim Carrey has.
You've got some issues with wear grooves, and hold on to them here, Bernie, and that's good. Perhaps just hold it down there a little bit so I can see too. So what I did was I repaired this tooth right here, that little area, so I didn't touch the original filling, it was fine, and I filled these areas at the back that were... A little later this afternoon I'm going to see Bernie, and his mouth is a little bit unusual. He has always been prone to bruxism, and as a result, he's worn a lot of literally holes in the chewing surface of teeth. With the new technology, we're going to literally bond a white composite material into these grooves, adjust them for his bite so that if he needs to grind and wear, he won't damage the teeth any further. And as soon as I place that one, we'll put the second one in.
Tuesday, I had a patient in from London, not Ontario, London, England. I have patients that come to see me all the way from Italy. I have patients that come from Jamaica. There's actually one here today that came to see us all the way from Jamaica. I'm going to lean you back, check everything out, make sure you're perfect, and get you clean and shiny for the rest of the summer.
Great. Sounds good to me. Good. And sweep up. There you go.
I'll try that. Great.
Scrubbing this
Excellent.
way.
Never tried that. Yeah.
There you go.
Thank you very much.
Claudette is an absolute fabulous assistant. We work close by, at least 8 hours a day. She's probably the best assistant I've ever had. She pours models, she takes impressions, she makes custom trays, stents for your implants. It's a real treat. The jaw is like a hinge the closer you get to the back.
To be a good dentist, I think it's vital to have a good assistant, and I have a terrific assistant in Tanya. Tanya's worked with me my entire career here. She started the same day I did, and she's been absolutely fabulous. She basically knows what I'm thinking before I think it. She can hand me the instruments as I need them. She's just fantastic to work with. Makes my job so much easier because she's so on top of her game.
So usually for June the 6th, Cheryl should be here, but she's not here.
That's right.
We're very selective in finding good people. And Charmaine and Emery hold down the front, and, they know all their patients by name.
Hi, Mrs. Babb. Pleasure to meet you. My name is Fulvia. I'm a dental hygienist. I'm going to be taking care of your teeth for you today. Has there been any changes in your medical history that we should be aware of?
No.
Fulvia's so thorough, and I really like that she explains what she's doing, and she's gentle and she's thorough, and every patient's ever come out of that chair, mouth has been spotless. This is what we like in our office. I'm very fortunate to have my wife Rhonda working with us. She helped me set up the office in the beginning, has worked over the years at times as receptionist assistant, chair side, designer. She's sort of the mother hen to all the staff, but in phones recalls all the time.
And my actual mother.
His actual mother. And she even directed you into dentistry, so that's not bad either. How you doing, Stevie?
Very good.
Haven't seen you for a while. Good to see you. What's Aaron creating for you today?
It's a real treat working alongside you. It's wonderful. It's great that we have the same philosophy and we can discuss cases together, and if I get stuck and I need a second opinion, you're always there, and vice versa.
Absolutely. For me, it's great. And the patients love it because they figure someday maybe I'll retire, although they won't let me, and you're here for them, and that's wonderful too, and they're really, really comfortable with both of us.